Good afternoon, everyone. My name is Dawn Bauman. I'm CAI Senior Vice President for Government and Public Affairs. Welcome and thank you for joining CAI and the Fellows of the College of Community Association Lawyers for this important webinar on community associations and COVID-19. I'd like to thank our presenters, David Graff and Matt Ober, for dedicating their time today to help CAI and our members navigate the coronavirus and its impact on community associations. The information we're providing in today's webinar is not legal advice. While these two presenters are brilliant attorneys, they do not have the familiarity with your governing documents, your community circumstances, and in some cases, your state and local laws to be able to give legal advice. What we hope you do is take this information and package it together with information from your local attorney, your local guidance, your local authorities, and prepare a plan for your unique circumstances in your community. Before we start, I want to give a little bit of an overview of the technology that we're using today, GoToWebinar, and then I'll also give an overview of today's webinar format. So the technology we're using, GoToWebinar, there is an opportunity for you to ask questions. The first part of this webinar will be a presentation from David and Matt. They'll be giving information about frequently asked questions that they've been hearing in their communities. And then the second part of the webinar will open it up for questions from everybody on this call. So on your control panel, there is a question tab. Please feel free to type in a question on that control panel. We'll be able to see those questions, pose the questions to the presenters, and get some answers for you. Okay, without further ado, and also if you have questions just about the technology, post a question on there, we'll be able to help you out. Without further ado, I'm going to turn it over to David Graff, an attorney from Colorado, Matt Ober, an attorney from California, and get started. Thanks, gentlemen, for being here. Appreciate it.
Thank you, Dawn. We are in uncertain times, and thank you for joining us in this rather uncharted territory. David and I are still figuring this out. There are ongoing discussions daily among counsel, among practitioners, among community managers, and volunteers as to how we're going to handle this. For most of you, you've not been called to lead a community in this manner. You're in a unique position. You have a unique opportunity really to serve the community and the public. And what we hope to do today is to share with you how we can apply what we know as community leaders and turn that into this crisis that perhaps we prepared for, but didn't necessarily know that it was going to be this type of crisis. So we're going to lead you through some areas of concern from communities across the country. The first area we want to jump into is communication. Communication with residents is going to be key during this time, and by all accounts, we are in crisis mode. Traditionally, the primary role of the association has been to inform and to disclose, right? To provide residents the tools they need to protect themselves. But we are now, with this overriding health and safety concern, we have obligations, I think, to do more to protect the community and the residents from known risks. And that compels us to act while still directing our residents to the experts, to the health department websites, to the CDC websites. It's critical that when you're not sure about the answers to some of these health concerns, direct your residents to the authorities. Communication with residents who are isolated and confined to their units or their homes is going to be critical. Their people are sitting around and they're staring at their computers. They're looking for the most current information. The more you check in with them, the more you email them what's changing in the community, what is closed, where they can get information, the more reassured they're going to be and the more reliant upon you they become. You should establish a central method of communication or a central location. Maybe it's the website homepage where information is always going to be posted there when it changes. Or it's a post or it's a bulletin board. Whatever you use, make sure that what you're putting up is consistent across all medium and also that it's the same location. Use Facebook if it's already established so that people can readily see it and can access it. Make sure that your date stamping your messages so people know it's the most current information available. And just, it's always okay to let them know you are there to help, to reassure them that if they need help, to reach out. A note to senior communities, Dave, I think you'll probably agree with this, is that I think seniors are especially at risk by all accounts, and seniors like to be communal. They gather around together, they play bridge, they're always together. And so to isolate them during these times is going to be very, very disturbing and uncomfortable. I think it's particularly important that community managers and board members of senior communities really reach out to their seniors and let them know they're there, and find out how the community can help the seniors who are isolated. Which brings me to volunteers. Now more than ever, volunteers should be used as much as possible while keeping everybody safe, of course. They can assist with email communication. They can assist in deliveries to the elderly. They should follow the same CDC protocols in terms of handling information and not coming within 6 feet of people, provide gloves, provide guidance, provide written material to the volunteer so that they could help you distribute that information to the community. And the last thing I want to just touch on is a little bit of technology, and that's the reverse 911 systems, or they're called voice broadcast services. There are a number of them on the website: Call Loop, Dial My Calls, Call Hub, and Simplycast. These are methods where you can load your emails or phone numbers and broadcast to everybody in the community at once information on a regular basis. So if you have time, take a look at those services and perhaps utilize them to your advantage. We don't know how long this is going to go, and so the more we're prepared as we go forward and as this crisis continues, I think the better off we're all going to be. David, why don't we talk a little bit about how we're going to limit guests during these times?
Well, right now, I'm not seeing a lot of communities limiting guests, and the answer to this question, if there is one, is first start with don't adopt a rule that you can't or won't enforce, because people will have visiting nurses, medical professionals, clergy, physical therapists, home health equipment people setting up apparatus. And there is no one size fits all to this, because there will be people who need to access residents in their units. Because of that, I haven't seen, and I'm not recommending that the associations take steps to limit guests. I think you could, particularly now during this time of crisis. It's not a remedy that we would normally entertain, but we are not in normal times. But we have to remember that there will be very legitimate reasons that people will need to access units. And if we have the ability to enforce that, then there may be some value in considering that. But right now, I'm not seeing that as a trend, just because of the difficulty of enforcing it and because of the position that it puts management and board members in, volunteer leaders, of value judging who gets in and who doesn't. Matt?
Right, particularly important. One thing that comes to mind is this idea that we cannot control the behavior of individuals, and what people do in their own homes is their business. It's just when that spills over into common area, when we see large groups of people, for example, entering a unit, when we see behavior like we've seen on the Florida beaches, for example, where people are not protecting themselves and the community, I think there may be a need for some sort of limitation. Particular with third-party vendors, food delivery services, access to the property has been limited in a number of communities where the deliveries are brought into the lobby, for example, they're labeled, and then the owner is called and either the food is brought up or the owner comes down to get that. I think we should talk about limiting in terms of management offices that are on site. We're cutting off access anyway other than emails for some of the management offices, because they don't want groups of people coming into the management office. Now more than ever, I think we have to protect management and staff from being exposed to risks that we can avoid. So either close the management office or limit hours, communicate by email only. I agree with you that let's not adopt a rule we can't enforce, which brings to mind another, I think, important advice. All these decisions you make either as management or a managing agent, for those of you that are managing agents, make sure that your board is aware of what you're doing. Make sure that the board has approved what you're doing. It's going to be particularly important for the board to be in lockstep with management on these decisions, these quick changes, so that the management is not out there exposed on their own to these issues.
I agree, and I think the idea of limiting on-site access is crucial, not only from the perspective of keeping staff healthy, but also from the perspective that staff may have been exposed to the virus.
Right.
And right now, to the extent that we can do as much business as we can outside of a face-to-face meeting, I think we're all doing everyone a favor. So I agree with that. Which brings us to meetings.
Meetings. Speaking of meetings, so when this all came down and the information about the virus became more prevalent, the questions started coming in, probably for the same for you, David, is that, you know, can we do meetings telephonically? Should we cancel meetings? We have an annual meeting next month. What should we do? It is probably the hottest topic, but I think it's really the most to really handle in terms of our technology. The board, I think, should defer non-essential agenda items. Anything that's not urgent, that's not important for the operation of the community, should be deferred if possible. If you can postpone a meeting for 30 days, do so. This is a great time to delegate to management or committee chairs or volunteers as much of the business of the association as possible so that you can get things done. Executive board meetings, I think, easily conducted either by telephone conference, Skype, or Zoom, or any other platform that's available. As for open board meetings, provide notice to your members, provide notice that the meetings are going to be conducted telephonically. There's some talk, some states have a requirement for a physical location of at least one person designated. I'm saying dispense with that. If there's a challenge to board action taken during this crisis, I would, be more than happy to defend that action. And I think, David, you'll agree with me that before any challenge to that would definitely be supported based on the emergency. So I suggest telephonic or video conference meetings only. Tape recording is always a concern for meetings held telephonically, and I think the admonition to whoever's on the call that they are not to record board meetings should be given. The issue of member comments comes up because controlling a telephone conference with members on the line could be particularly difficult. I would say identify the speakers before speaking. If you're on a system where you can control who speaks before they speak, I think that's an excellent system to use. One thing, David, I don't know what your thoughts on this, is considering an email system where the owner emails their comments to a single email address, and then the board reads that comment on the telephone conference. That may be an effective way to have owner comments without having people interrupt each other on a telephone call. But it's an interesting idea.
It is, and it represents the tension between wanting to follow each and every formality in the law or in the governing documents and trying to get business done in a way that was never contemplated by the governing documents or the law. And the fiduciary duty and the duty to act reasonably does not go out the window, but it changes in terms of how we respond to this. And to the extent that there are formalities that get in the way of keeping people safe, my recommendation is to get rid of those formalities and do what you can not to have interaction with people that is not necessary. And we'll see where that falls. But with having owner comment period, it requires some coordination and some forethought and perhaps even a dry run. I do like the idea of getting owner comments either by email. I like the idea of using a platform such as this, but as the size of the crowd of the owner participation grows, as we found from last week, sometimes the logistical difficulties of managing that grows as well. And my suggestion is, as Matt said, postpone the non-urgent action items until we can figure out per community a way to handle this without introducing more chaos into the lives of our homeowners.
That's very true. You've got people sitting at home doing nothing, and so why not phone into a board meeting? So you could have a tremendous number of phone calls. One last point that I want to make before we get off the meetings is if you have any pending committee meetings scheduled in your community, those could be probably suspended or put off indefinitely. The landscape committee doesn't need to meet. The one area that I think poses some concern is architectural review committees. If you've got any applications pending, and if you have a deemed approved provision in your CC&Rs, that committee is going to need to address the pending application, because 6 months from now, when we're all clear, God willing, we don't want to have anybody say, well, you didn't deny this in 30 days, so it was deemed approved. So that's something that you need to pay attention to.
Agree. Well, let's talk about closing the common area facilities that we may have within a community. And this is evolving like everything else, but from my perspective, the most immediate decision to make is which facilities are essential and which are non-essential. So for me, weight rooms, yoga studios, fitness centers, meeting rooms, largely non-essential versus the elevator, general common element doorway, mail room, laundry facility, probably essential. Pool, I consider non-essential, but I don't live in California. So that will play a role depending on how long the shelter in place requirements remain in effect. But my personal belief is right now it's non-essential, and with respect to all of those, most of our clients are closing them until they can be reasonably assured that there's a cleaning protocol that they can deliver and communicate to the homeowners that they should have confidence in using those facilities. And right now,
Right.
most boards that I've spoken with don't have that confidence. And so we are seeing those close. And for the essential common areas that need to be open for access, egress, we're having our clients look into what advanced or enhanced cleaning protocols they can adopt and communicate those to the residents so that their membership has an idea not only of what the association is doing, but perhaps more importantly, what it is not doing and what it may not be able to do right now.
Right, right. And it's interesting, this has changed just in the last few days with respect to playgrounds, for example. I mean, last Thursday, playgrounds were okay. And it also depends on which state you're in. If you're in California and New York, playgrounds are off limits now. And so it's changing, and I think it's important that we are flexible and respond to the urgency. You may be able to keep a facility open, but you have to have staff in that facility, and staff is at risk, or as Dave mentioned earlier, if staff is exposed or tests positive and doesn't know it, that staff member could spread that virus to others. So I think if it's a non-essential area, common area, it should be closed down if you cannot keep people 6 feet apart and follow social distancing. So I would agree with you on that.
Excellent. Assessments.
Assessments. This is an interesting topic, and really one nobody's mandating we do anything yet, but particularly in the area of community concern, compassion, leniency. I think that boards and communities are going to have to be a little sensitive as we move forward to late charges and interest, for example. Perhaps consider waiving that as owners are suffering economic hardship. Some of them have lost their jobs. Many will lose their jobs. Many will be short of cash. It'll be important that the board be considerate, perhaps adjust your collection policy to delay commencement of assessment collection for a period of time so that we can wait till people get on their feet. I think we're going to have to be sensitive here. We're getting questions, believe it or not, should we get a credit on our assessments if you're closing the pool or you're closing the rec center? I don't know how you feel about this, David. My answer is no, because all owners are affected equally by the closure. We're not treating people dissimilarly, and I think under the circumstances, the closures are health and safety mandated, and the community still has to operate. You still have insurance payments, you still have utility payments, you still have all the services that everybody needs in order to keep the community running.
I agree, and it represents to me a misunderstanding of the nature of property ownership, where the homeowners own those facilities collectively, And not only do they sometimes not cost less to operate when they're closed, with the cleaning protocols, the association needs its revenue now more than ever because it provides essential services, depending on the community, insurance and everything else. I agree with you, Matt, in terms of being sensitive. What we don't yet know is what's going to happen with the association's vendors. Will the insurance carrier accept payment of its premiums late? So I'm not advocating for a community-wide notification that says no one has to pay, because we don't yet know what essential services that the association will have to provide will give us the latitude to pay late. But I agree that it's a sensitive issue, and being attuned to the sensitivity of it, I think, is crucial to begin with. But I wouldn't, with what I know today, make a blanket recommendation with respect to assessments other than keep your ear to the ground.
Yeah, I would agree with that, but it's going to be, I'm envisioning 4 months from now, we look at our delinquency log and we're going to have to decide how are we going to move forward with some compassion and consideration.
Completely agree.
It's funny, I'm going to toss the next topic to you. We had a lot of discussion about construction contracts, and this is another area that's changed drastically since last Thursday. What's your thought on, do we stop contractors from going into units to continue repairs?
Well, to me, it depends, number one, on what the repair is, and number two, what the vendor has in terms of the availability to even perform under the contract. And so I think for boards to look at pending construction contracts, roofs, for example, that may not be deferrable versus lobby beautification, the first step to me would be to either talk to the attorney and or talk to the vendor to see what type of options they even have with their workforce to deliver that, and what willingness they might have to defer that to a time when they could be better able to protect their workforce. Is that where you're coming from, Matt?
Yeah, you know, it's interesting. I have communities that, like I mentioned earlier, will limit food vendors from coming in, but they allow contractors to go into unit. The interesting thing that has developed is not necessarily concern about who's coming in, but because people are staying at home or working from home, the noise that they hear from construction going in other units is noticeable. And so people are now sensitive to it and want to stop the construction. And so one suggestion for communities, perhaps limit the construction hours if it's essential construction. And if they're simply doing a volunteer or you know, a remodel that is not essential, perhaps work with the owner to say, can we put this off? And of course, as you mentioned, I think it's critical. If the vendor can't comply, then perhaps we stop the construction until this nightmare is over.
I agree. How do you deal with quarantining residents, Matt?
Yeah, speaking of nightmares, you know, this is a difficult issue, and as the numbers grow, it's going to become even more difficult because more and more of those of us in our communities are going to be quarantined. The issue for managers or board members is, what do I have a duty to disclose if somebody comes to me and says I'm positive or I'm going to be quarantined? I think we have to remember this is not a social disease and there shouldn't be any stigma associated with it. But that being said, I think we have to guard against labeling or identifying somebody who does not want to be identified. So perhaps we contact the local health department and get guidance from our authorities on, we've identified somebody who is positive, what do we do? That health department may be coming into your community for all we know, because they want to notify the community to take particular steps. I think we talk to the person who has tested positive and confirm that they are going to self-quarantine, where and for how long, confirm that if they need assistance. And at that point, you are comfortable in knowing that that person is not going to necessarily expose the community to the risk. That person is also going to need assistance. They're going to need assistance with taking the garbage out. They're going to need assistance with package delivery. And so management or board representatives or even volunteers are going to have to identify that person so that they can be there to assist that resident. with their needs. So it's an interesting tightrope, I think. But I think an automatic disclosure of the identity should not be the norm. I think we have to be very careful about how we're identifying people.
I agree. I don't, and this may depend on circumstances, but generally I agree with you completely, which is I don't believe that there's utility in naming people, and I think it may have the opposite effect of that intended, which is to get information and be able to pass along something meaningful to the residents. And if people are ostracized or stigmatized or feel that way, I think we've gone in the wrong direction personally from protecting people, which was our original intent.
Right.
Which is, how do you handle a confirmed case? And the first thing I think is decide what we're going to communicate to the membership, preferably without naming people or identifying them in any meaningful way, unless we had a very good reason to do so. And then I think we have to consider what staff and what the board can do to make the quarantine more palatable, if possible, right, which might involve getting mail, delivering food or packages between the door and the unit.
Right.
But I also think that we have to think ahead to the days that perhaps staff tests positive, and staff is then going into self-quarantine for 14 days or longer, and there is no on-site management staff or available management staff to do anything.
Right.
And whether that will be volunteers who are willing to do that, I don't yet know what that looks like, but I think we have to brace ourselves for that possibility that we may not be able to provide all of the services that quarantining residents may want due to our own issues with the virus.
That's an excellent point. But the flip side of the don't identify the resident is if you do communicate to the community somebody has tested positive, I would imagine the first question you're going to get from 150 residents is, who is it? What floor are they on? I have a right to know. And so part of this, the difficulty of this topic is we don't have all the answers. And I think we have to do what's right for the community we're in and the circumstances that we're given. And if you're in a community that will support somebody and the resident says, yeah, I want people to know, then that's an easier place to identify somebody. But if you're in a community of 400, 500 people and 16 floors, and it might be a little difficult to just say somebody in the building has the virus, but we can't tell you who it is. It's going to be a very challenging thing to negotiate.
It will, and HIPAA laws, in my opinion, do not apply to community associations as a covered entity. HIPAA laws, Health Insurance Portability and Accountability Act, requires very strict guidelines in how healthcare professionals or insurance companies handle sensitive medical information. I don't believe that we're covered as associations under those laws, but I think we also have to be mindful of the fact that these people are not bad people. They didn't do anything wrong for the vast majority, and we have to treat them like people who are recovering from an illness, which is what they are, and on a case-by-case basis, if there's a need to disclose more information, or if there's a desire on the part of the owner to disclose that information, then we take that into account on a very, very specific fact pattern basis.
Right, I agree, 100% agree. Difficult times indeed, and the last thing you'd want to do is identify somebody and create just a nightmare for them that raises all sorts of concerns about fair housing and hostile environments and the preventing them from actually enjoying their home as a result of being improperly identified. So we have to be really careful here, I think.
I agree, and unfortunately, it's a limited window of time because we're dealing with, the first or second positive test results in a building.
Right.
A week from now, I don't think this will be an issue in the least because, again, I don't want to be a doomsday predictor, but I think that once one or two people have been identified, everyone will understand that this is very real and very immediate for all of us.
Agree. So should we bring Dawn back in and take some Q&A?
I think it's a great time to do that.
Hi, gentlemen. Thank you so much. I'm always amazed to see a question posted and then one of you answer that question immediately after it was posted and you never had the opportunity to even see the question. So, so a couple of questions that came in have already been answered, but we do have some other ones that are really good questions. There's a question about an annual meeting notice. So here it is. Should we send an annual meeting notice in order to adhere to bylaw requirements, at least 30 days notice in advance, et cetera, et cetera? Should they keep that standard, or should they defer everything not knowing when they're going to be able to hold that meeting?
Wow. So annual meetings are an interesting animal, if you will. I do think we could try the telephonic annual meeting to hold the annual meeting. And so following the bylaw protocol, I think is okay. Where I'm a little bit, we have to be a little creative with respect to an election of directors in connection with an annual meeting. And do you want people sending in their written ballots to an inspector after having handled that and licked it and not knowing what's on that envelope? I'm not sure. But if you do have ballots sent in, or there's an annual meeting pending, or you do conduct your annual meeting, you probably want to have the inspector or whoever is counting your ballots on camera somewhere so that everybody could observe the counting and you can conduct business that way. But I think creativity in conjunction with your bylaws is going to be important.
I agree. I would say that we stick with the meeting protocol in terms of the notice that would be required. But the real question, I think, is how do we administer this meeting? Is
Right.
there a way that we can do it in an open and fair manner, that the owners have the participatory rights that they should have? And if they can't, my response would be that we would defer that annual meeting until we had the ability to provide proper notice and have some reasonable assurances that we could deliver to the homeowners what they're expecting in terms of an
Right.
election or whatever else is up for vote.
Right. You may not even have people willing to step up and be candidates for the board to run for the election, given all the circumstances. And if there was ever a reason to postpone an annual meeting, I would think this would be it.
Yeah, I agree.
I'm not surprised to see there are quite a few questions related to essential workers. And it's interesting because we just had a call last Thursday, never even thought about this as a topic.
Right.
And then all of a sudden over the weekend, a number of states have ordered stay-at-home orders. The governors had made declarations for stay-at-home orders. And in those orders, there's a categorization for essential workers, and whether community association managers and or some of the building facilities maintenance managers are essential workers. So what do you gentlemen think about this? I know you don't know every single state stay-at-home order, but what do you think about the essential workers and community association managers?
So being in California, we are hit by the orders Thursday night, just after the webinar. And that was the first thought, is who's essential and who is not. And as the weekend rolled on, we all were interpreting what is essential and trying to figure out, can a law firm be an essential worker? And I think it's going to depend on your state and reference to the federal guidelines. There are some guidelines on what is an essential worker. It is surprising to see some of the businesses that are open that are considered essential. Your trades are essential. The discussion we had over the weekend with some of the colleagues is community managers, are community managers essential or non-essential? Do they provide essential housing services? That may be the case. The difficult issue is what happens when that essential worker tests positive. And so I think for the time being, we're going to have to look at our state, and you're going to have to consult with counsel to get a fair interpretation of whether your staff member is considered essential or not. Dave, any thoughts on that?
I agree. No, I agree. And from my view, it's a little bit all over the board and situation specific. I don't think there's a one size fits all. I think many community managers are often in an essential worker situation if they're going to the building to deal with a vendor issue or to inspect a roof leak or to deal with some emergent issue. And it's difficult to apply a one size fits all. And I agree, when someone is testing positive, the last thing anyone needs is for them to go out of their home and be in contact with other members of the public or other members of our community. So this is going to continue to change, but I think that in many cases, community management will be essential depending on the context, and I think they'll only become more essential as people are living and trying to work from their homes.
Right. You know, your answer raises an interesting thought in that the whole idea of essential businesses, my understanding of it is not necessarily to have individuals travel all over the community to their place of work, but necessarily to have businesses open that are necessary to conduct life as we know it, or the essential services. But to have an association manager with a family at home leave that home and go to a community and perhaps be exposed and then bring that back to that family, is that in keeping with the idea of flattening the curve? And I don't know if designating them as essential really serves that purpose. It's a difficult question to answer.
No, it certainly doesn't flatten the curve. I think the only issue is that when there is what could be called a property emergency within the community, who's going to handle it?
Right.
Because the homeowners will certainly expect it to be handled, and that's going to require some coordination between management and the board members.
You know, something you mentioned earlier about if the manager tests positive brings to mind the need for the board to be in contact with the decisions and the action taken by management if the managing agent no longer can come to the property or no longer can serve the community because they are quarantined. The board has the ultimate decision-making authority, and the board needs to know the decisions made by management on the board of the association's behalf so that the board members can step in if needed to help lead the community. I think that's critical in this state.
I agree.
And one of the a couple of issues related to the essential workers, CAI is gathering all of the stay-at-home declarations. We'll be putting that on our website and kind of going through those declarations to see what language may or may not impact community association managers. One of the things that we've noticed as we've gone through the first about 10 stay-at-home orders is that all nonprofits are usually included as essential workers or essential organizations, which could be community associations. And there's also a public works, which this comes directly from the federal government, a public works statement related to the health and safety of residences. So that may or may not include community association managers. But we will put that information on our website and have that information available for our members in the coming days. Here's a really good question. Can an association board enforce a restriction on short-term rentals due to bringing people into the community who are those guests or who are not residents in the community?
Well, just based on my state and my experience, usually the restriction that we would try to enforce would have some basis in the covenants, the CC&Rs or the recorded declaration. If the question is, can we tell people no short-term rentals without any authority within the governing documents, I think it's difficult legally if it's challenged because we wouldn't have any support from our own governing documents to say that you can't do this. These are desperate times.
Or a temporary restriction due to the pandemic circumstances.
That's a phenomenal question,
Yeah, it is.
which is part of the sport of doing these programs. I think that we have to step back and look at, is the activity we're trying to regulate creating an additional risk or a greater risk of a health and safety concern? We don't want 12 teenagers going to the spa, so we shut the spa down. If somebody has an ongoing short-term rental and it's permitted by the governing documents, then again, it's hard to regulate the behavior of individuals that is not putting other people at risk. So if they're renting to 2 people, I don't know who's really looking at rentals right now. I can't imagine somebody doing that, but perhaps somebody is looking for a place to live or they're out of their home for whatever reason. I can see a situation where there's two people going to rent a unit. I don't think blanket prohibition necessarily addresses the health and safety risk in that case. And if there isn't a basis in the governing documents, I'm not sure that I would recommend that.
I agree. Some of the ordinances where we work in resort areas have driven out short-term renters or people on vacation, even people visiting a second or third home. And typically there's an exception for travelers passing through for essential services or what have
Right.
you. And I'd rather rely on that to enforce something that doesn't exist otherwise in our governing documents.
Correct.
As of today.
Here's an interesting
today.
question.
Yeah.
What if a service provider can't meet the terms of their contract because they don't have the employees to be able to provide the services that are being offered or needed to be met in that contract? Can the association terminate that contract and hire a company that can deliver the services for breach of contract?
Ooh,
that's a Latin term that's in those contracts that we always read and say, does that ever apply?
Force majeure.
Right. So is this an act of God? I think somebody asked that question previously, because we have provisions in contracts that say we're not responsible for delays on account of acts of God, earthquakes, fires. Is this one of those? Is this an event that's beyond the control of anybody? And is that a basis for a contractor saying, I can't get materials because my supplier's closed and I can't finish the contract for another 6 months? I shudder to say that these are issues that are going to be resolved maybe 6 months to a year after the crisis, because they are going to be disputes that arose out of pending contracts. And I think that it's now more than ever probably a great time to have a dialogue with your contractor and seek to amend the agreement. If they cannot deliver, say, then let's postpone this. Let's do an amendment to the contract and set this over for 3 months and see what happens. Those are my suggestions now. Dave, anything
Yeah,
you would do differently?
so again, this is going to require the association's attorney to get involved, because the force majeure or some of those contracts that have acts of God language may only excuse performance for a little while. It may be an entirely separate thing to establish a breach of the contract entitling one party to terminate. Sometimes contracts have the right to terminate for convenience, meaning no cause. Sometimes they require a breach of the contract in a material way, and in some cases that breach must continue after notice to cure has been provided. So number one, talk to the attorney, because if you just terminate the contract, you might get sued on it, and they may have a good argument that you would be liable to them for damages. But as Matt said, have that conversation. I'd be much more inclined to allow a contractor doing a construction project that is non-essential to extend the time for performance. If it's our janitorial cleaning crew that has been cleaning our common areas and they can't show up, now we have an emergent health issue. And the question is, can we find that service somewhere else? And the answer really is, it depends on what the contract says. Sorry to say.
Here's another good question. Do you think the board has an ability to stop reviewing architectural covenant requests at this point?
So it touched on that earlier. I think that it's one of the hardest issues that I don't have an answer to, and that's, you suspend committee activity because it's non-essential. The landscape committee can wait, but can an architectural committee hold off on its responsibility? Maybe it's because the project that they're thinking about is non-essential, and you conclude that we're putting a moratorium on any non-essential construction projects. I do think we have to be aware of any kind of deemed approval provisions in our CC&Rs, because somebody might hold on to that to say, my third floor balcony was deemed approved because you didn't deny it.
Yeah, I think that I agree with everything Matt said. And sometimes the answer, in my opinion, is it depends on how we've done it before. And if we have had the ability to administer these things, we may have every ability to continue to approve or deny them, and it might require a conversation with the owner about who's coming and going when. The thing that I would worry about is in issuing a blanket moratorium on applications, there may be applications for reasonable modifications based on a disability, for a wheelchair ramp, an air conditioner to deal with somebody who has
Right.
MS, a stove for somebody that can't reach their cooktops. I mean, there's all kinds of disability issues wrapped up in this potentially that we could run afoul of if we say no more. So if we're going to put these on hold for now, we would still want the ability to deal with applications that come in that may not be able to wait in good conscience.
Excellent point, and which reminds me of something I neglected to mention earlier, and that's the importance of board resolutions during this time. Any resolution that perhaps put a moratorium on architectural, non-essential architectural application, with the exception for health, safety, or reasonable accommodation requests, should be done by written resolutions, because we're going to need a paper trail for all the decisions the board made. It sounds like more red tape than we need right now, but I think it's really important that there is this paper trail.
I agree.
We talked about a couple of questions related to the pools. I have two additional questions. One being, the CDC has said at this point that they don't know that COVID-19 can be transmitted through the pool, so they have made no recommendation of pool closures, etc. At the same time, I believe the CDC's current guidance is no more than 10 people in a social gathering. So if you have a pool open, then of course you would have to restrict the number of people in the pool to 10 people. So that's kind of a conundrum. What kind of advice do you have relative to that conflict there?
Well, the first piece of advice to me would be any decision you make today or tomorrow will need to be re-examined in a week.
Right.
Whether it's to keep it open or to close it based on the guidelines, because it is changing quickly, and I think we all have to resist the urge to say, okay, we decided that and we're no longer going to examine that as a possibility. The concern, I saw the CDC's information about the pool, which I believe is the most current, but it doesn't necessarily address the fact that there are other flat surfaces or other surfaces that may have the virus on it that could remain contaminated anywhere from, I think, 3 hours to 2 days, depending on the type of surface it's on. So whether the virus can or cannot be transmitted in the water doesn't mean that it cannot be transmitted from a door handle, a doorknob, a towel, you name it. So I think we have to look at it not just from that limited perspective, but from all of the surfaces that we would worry about somebody getting this virus from.
Right.
Matt?
Right. Yeah, I agree. The other thing that comes to mind is, there's so much we don't know, and the other surfaces is a problem. The social distancing issue, as weather warms up, if it ever does warm up, and you've got kids that are home, kids are going to go to the pool. And who's going to control the kids? And do you have a lifeguard? And if you have a lifeguard, are you exposing the lifeguard to that risk? And so just as playgrounds shut down here in California, so have pools. And it might just make sense under the circumstances. You may not have to shut it down, but it's probably the right thing to do, given all that we know and all that we don't know right now.
It's a great lead up to the next question, which is, if your board determines they don't want to open the pool for these exact reasons, but the pool company in which you have a contract with will not agree to amending their contract, and they want to open the pool when you've agreed upon opening the pool, how do you handle that?
Well, I think, to me, there's a difference between them providing service so that the pool is ready and the board deciding to open the pool. And I've never experienced a contract where the pool vendor has the right to decide whether the board will open that as an amenity or not. Whether they provide services so that it is safe is a different matter, I think. First thing to remember, who runs the amenities? The
Right.
board on behalf of the homeowners, and usually not the pool vendor. Matt, if I cut you off, I'm sorry.
No, I'm thinking that when things are closed down and not in use, sometimes the maintenance is even more important. than when they are used. And the fact that we're not using these facilities doesn't mean that we don't have to keep them maintained, which goes back to the assessment issue and why we can't say don't pay your assessments for 90 days, because we still have to clean the pool even though it's not being used. We still have to maintain the hillside slopes. We still have to keep the irrigation on. So I think the fact that something is closed doesn't prevent or eliminate the need for the maintenance on that component.
I agree.
I'm going to wrap it up with this final question and then some final comments as well. Do you think it is better to waive late fees and interest for all owners for a certain amount of time, or handle those requests on a case-by-case basis? And I'm assuming this is related to assessments and late delinquent assessments.
I would say wait till the association has a handle on its delinquency status and sees the number of delinquencies. And as any delinquency matter is handled, it's handled with each individual owner. And perhaps the board thinks of adopting a policy that for any delinquent owner, it will waive interest and late charges, but approach it on an owner by owner basis rather than a community-wide announcement. I don't think that's necessary.
I agree for today, and this may change in a week. I think that's exactly the advice that I would give is stay flexible, because we don't yet know how the association is going to be pressed to pay its vendors and what latitude it will have with those vendors for the essential services that everybody will be demanding.
I agree.
Excellent. Thank you, gentlemen. Thank you so much for being here, both of you, and for taking your time answering these questions and preparing for this webinar and for last week's webinar. I'd like to point out two different resources CAI has available to everyone, or three available to everyone on this call. First, we have recorded this, so we will make this recording available via YouTube, and we'll send that information out to the attendees on this call. We have a web page that we have been updating regularly with a lot of content, information, and guidance. And that web page is caionline.org/coronavirus. Finally, we have our online community, which is CAI Exchange. You can find that exchange on our website. It's a bulletin board where people can post questions, get answers, so you can continue the conversation on this particular topic and any others that will arise in the coming days. I wish everyone well and good health, and please turn to CAI and share your resources with each other as we try to get through these challenging times. Gentlemen, thank you so much. Any last comments?
I'll just say thank you to you and your team for putting together quite a number of excellent resources for volunteer leaders and management. I think it's excellent, and thank you for doing that.
Yeah, absolutely agree. Excellent work. Thank you.
Our pleasure. Thanks, everybody. We'll
you.
be stopping the recording now and wishing you all well. Thank you.
Thank you. How are we doing?
And we're off.
Well, time-wise, great questions.
Yeah,
Very
that
good
short-term
questions.
rental one, that's